Hi, I'm Tammy Johnson. I'm here to show you the skill for your state test of shaving the male face. Now on your table you will have gloves, aftershave, shaving cream, a razor, washcloth towel, a basin, and you can verbalize the sharps container, but I do have one over here to the side. Okay, so we're going to get started. Knock on the door, look at the wrist. Hi, Mr. Jones. It is a male because we're doing the male face. I'm Miss Tammy. I'm here to shave your face. I'm going to provide hand hygiene anytime and any skill that you're going to do hand hygiene. I would like you to raise your hands up and say hand hygiene and then pull the curtain. You will actually have a curtain at state to pull. Then, very important because it's a critical step, we have to raise the rails. You always raise the rails when the bed is moving up or if the bed is moving down. Just come over to the other side, raise the rail. And I always like to work in nursing. We always work from the head to the foot, far to near. So I kind of even do the side rails like that. Now, another critical step, very important, is that we're going to raise the bed up to a good height for you. I should not see you bending over, nor should I see you tippy-toeing. So it needs to be comfortable. Lower the rails because we never work over the top of rails. Then I'm going to place the mannequin in a Fowler's position. It may say in your skill book in a seated position that would be the Fowler's. Now you don't have to necessarily go quite that high, but do set him up. Then I'm going to put my gloves on. I'm going to put the overbed table with the supplies on over the top of him. And I will take a washcloth. I'm going to kind of just wash the face off. We always wash in a circular motion, but leave that water on to soften the beard. I'm going to put a towel across the chest, make sure his gown doesn't get wet. Then I'll take shaving cream, put it on, just kind of rub it on the face. And then you take your razor, working from the far side, hold the skin taut, down, long strokes down over here. And every once in a while, just rinse it off a little bit. I'll probably do 2 swipes here. And then real short ones right here around the lips and chin area. Okay. Then I'm going to rinse that off, and this is a very important critical step at this point. I'm going to observe for nicks and cuts. I would report those to the nurse, but it's very important that you observe for those, and you will use aftershave if there's not any nicks or cuts. And then we will remove the towel, and in any skill, if you have a bed protector on or a towel on, when you remove the towel, that is when you remove your gloves, because often not only putting gloves on is important, taking them off is a critical step. So I'm removing the towel, putting it in the hamper, removing the gloves correctly. I'm going to clean up my supplies. I will put the razor in the sharps container. It says you can verbalize. Move this out of the way. I will raise the rails because when the bed is moving up or the bed is moving down, the rails are up. I will probably, it doesn't matter if you do it before or after, I'll probably go ahead and put his head down. I don't believe it mentions in the skill to do this, but I always ask my students to return the resident into the position that you found them. So the rails are up so the bed can go down. So that is a critical step, and if you miss this step, you will fail your skill at state. So the bed goes down, then the rails go down. Again, very critical step that the rails are down when the bed is down and you're getting ready to leave the room. And I like to always come back and kind of where I started, get him comfortable. Another critical step is the call light. You can't just say it. It has to be within reach. hand hygiene, and report and record. Thank you.